Is pain important? The simple answer is yes. Is chronic pain important? The simple answer is yes. It has its own medical specialty, the same way people are specialized as surgeons, physicians, neurologists, nephrologists, oncologists. We have pain specialists because chronic pain is rife. Chronic pain, unfortunately, is everywhere and it affects a lot of us. It has some far-reaching consequences, chronic pain, both at a personal level, at a family level, at a work, community, society level. So let's have a look at chronic pain and why it is so important. This is the National Pain Strategy. This was published in 2010, so a long time ago, and the figures are astounding. And these figures are still relevant today. There have been some subsequent updates, but essentially it still rings true. 1 in 5 Australians, this includes children, adolescents, will suffer from chronic pain in their lifetime. That is 20% of us. I have friends, I have family members that suffer from chronic pain. It's going to happen to a lot of us. It's a massive problem. If 1 in 5 are getting pain, the next line says that 80% of people with chronic pain are not getting the treatment that they could have access to. So not only is it, does it affect a lot of us, a lot of those people with chronic pain are not getting the treatment that they need. Friends, family, employers, healthcare professionals do not believe that they're in pain. I have seen this with medical colleagues, allied health colleagues, people around me, patients that tell me stories over and over again. No one believes I'm in pain. And that's just not good enough. It really isn't. The people that end up treating patients with pain don't have the appropriate training to assess, to manage chronic pain. So those few people that end up treating, the few people that get to somebody to treat them, are not necessarily appropriately trained in pain management. And we'll discuss what a pain specialist is at another point. Those that get referred to a pain clinic, notably in the public sector, might wait 6 to 12 months before they see somebody with the appropriate training in pain management. People that have chronic pain, you're probably watching this because you know somebody with chronic pain or you have chronic pain yourself, are at risk of anxiety. They're at risk of depression. Most of the time these are commingled. They get physical deconditioning, so their body gets stiffer, their body gets weaker, they get unfit, which has multiple medical, psychological, and further reaching consequences. You've got poor self-esteem. There are relationship issues, and I've seen chronic pain destroy relationships. My husband, my wife does not understand that I'm in pain. They do not believe me. They say I look okay, but I'm suffering. There is loss of independence. And this is for people with chronic pain, but this extends to people with cancer and cancer-related pain. We're just not doing a good enough job at managing cancer and cancer-related pain. And the same thing applies to acute pain, pain following an injury, pain following a surgery. We're just not doing a good enough job. There are just not enough appropriately trained pain specialists that can give people the treatment and care that they require. Let's look at the numbers. This is something that you can access yourself, the Deloitte Economics Cost of Pain in Australia publication, published by Pain Australia a number of years ago. 3.4 million Australians are suffering with pain. That's 20% of the population, roughly 16 to 20% of the population. Don't worry too much about all the numbers, but go down to the $73 billion in financial costs for those suffering with pain. $66 billion in quality of life costs. So this is loss of quality of life if you want to put a financial number on that. And essentially, when this was published 2019, the rough estimate is chronic pain cost the economy $139 billion. And that's going to be over $200 billion in 2050. So the numbers are staggering. Let's have a look at diabetes. Everyone talks about diabetes. Not many people are talking about chronic pain. In diabetes, there are 1.3 million people suffering with diabetes. That's 5% of adults. Chronic pain, 20% of adults. In 2021, diabetes cost the economy $3.4 billion. Compare that again to chronic pain costing hundreds of billions of dollars. The figures are astounding. Let's just look at a couple of other consequences of chronic pain. People with chronic pain don't live their lives. They are limited in function and ability to enjoy life. They are limited in their daily activities. GPs are seeing far more people with chronic pain. And I think the numbers were the GP consultations have risen by about 67% over the last 10 years. Are those consultations for chronic pain, some form of persistent pain? You're more likely to be prescribed medications. You're more likely to be prescribed opioids for chronic pain. Not only does chronic pain affect people in terms of limiting function, seeing more GPs, getting dispensed or prescribed more medications, sometimes medications that are dangerous. You're more likely to attend hospitals as well. So I get many calls about patients that are that have attended an emergency department by the emergency physician asking for help. So there were over 100,000 hospitalizations. That's not emergency department visits, that's hospitalizations. You're coming into hospital related to chronic pain. This is the boom-bust cycle of chronic pain, and this is something that it's important to understand. When you have pain, you stop moving. When you stop moving, you get stiff, you get weak. That stiffness and weakness causes what we call deconditioning, which we'll come to. That deconditioning, funnily enough, makes pain worse. So the things that people end up doing actually potentiate, worsen the situation. And when you're suffering in chronic pain, when you're in the middle of it, you don't know how to get out of it. And this is why you need help in understanding these factors. So understanding chronic pain, understanding what's happening to your body is fantastically powerful, because if you know what your body's doing and why it's doing it, you're starting to take back control again. So now I'm stiff, I'm weak, it hurts. I move my body a little more, it hurts even more. My brain says to me, don't do it, you're damaging yourself. So you do less, and you get into this vicious downward spiral of pain. That's the bust part. Now it says boom bust. So the boom part is you might have a few hours or a day when you're feeling okay. I'm good. I've got a week of activities to catch up on. I've got stuff to do for my family. I've got stuff to do for work. I've got stuff to do for myself. So you end up booming. So you do a whole bunch of stuff in a short space of time. And guess what happens afterwards? You're busted again. So you boom, you bust. Happens to almost all people with persistent chronic pain. This downward spiral, as I've said, has the detrimental effects. So again, what are the consequences of what happens to people with pain? And these consequences of this so-called deconditioning can have biological factors and effects on you, can have psychological and of course social effects. So deconditioning, it's a complex process that follows a period of inactivity. So let's have a look at the biological, what deconditioning does to a person's body. You get weak. Your endurance goes down. You get less flexible. You have reduced aerobic capacity. Your muscles shrink. You get stiff. Your joints get stiff. You get less coordination. You get risk of falls. You have less proprioception. You don't know where your body is in space. Calcium goes down. Bone strength goes down. Osteoporosis, the risk of osteoporosis goes up. You're at risk of fractures. People get overweight. You get high blood pressure. You get cardiovascular problems, cardiorespiratory problems, heart problems, energy fatigue. This has knock-on effects on the stomach. This has knock-on effects even on reproductive function. The biological effects of deconditioning can be profound. Psychological effects. If you're living with chronic pain, I know somebody, they're likely to be anxious. They're likely to be depressed. They're likely to be angry. They're likely to be demoralized. They're likely to be frustrated. They don't have self-confidence. They don't have that capacity to cope with the pain. And they've got what we call reduced self-efficacy. They are not able to enjoy life despite the condition that they're living with. This has effects on society as well. The relationships suffer, work suffers, working capacity suffers, the ability to give to the economy suffers as well. So chronic pain affects all aspects of oneself and the world around oneself. A lot of people say to me, does pain kill? And that's a really good question. And the answer is, we don't know. I've just picked out 2 studies to show you, to give you a little bit of an idea about what we think and how we approach whether pain actually causes mortality, which is death. Morbidity is suffering. We know that pain causes morbidity, suffering, but does it cause death? This is a study done in 2019, mortality of patients with severe chronic pain in a multidisciplinary pain clinic. They looked at 6,000 patients, just over 6,000 patients. This was in Denmark over a period of time, roughly about 10 years, and they looked at the deaths amongst those patients. There were 276 deaths observed among the chronic pain patients, and there was a 6-fold higher mortality rate compared to the general population. So from the single study, the single practice, a single group of patients, it appeared that there was a 6-fold higher mortality rate. Now, they didn't look at why this has happened, and we can surmise, is it because of deconditioning? Pain patients are deconditioned. They're on more opioids. Opioids can have profound effects on the body, particularly high doses over long periods of time. Is it because they're unwell? Is it because they're slightly got less healthy cardiovascular system, so they're more risk of diabetes, high blood pressure, cardiovascular problems, and hence this is why the mortality rate is higher? We don't know exactly, but it appears there may be an association with higher mortality. Is this, as I've mentioned, is the reason, these are just posed questions, is the reason because of poor diet, poor activity levels, smoking, high body mass index? So is that because the patients in pain have these health problems that they're more likely to die? Is it because of sleep deprivation? We know sleep deprivation can have profound effects on the body. Is it because of opioid use? Is it because of opioid addiction? Smokers, we know that smoking has profound health effects. We know that people with chronic pain are slightly higher risk of smoking. We know that nicotine has an effect on the opioid system and interferes negatively with the opioid system. We know that cancer is more likely to occur in immunocompromised people. We know that opioids can suppress the immune system. Is it because people with chronic pain are more likely to take opioids, which is more likely to suppress the immune system? Is that why the mortality rate, the death rate, may be higher? So we just don't know, but there may be a link between people with chronic pain and higher death rates. That's frightening and that's astounding. Is it because people with chronic pain have more mental health problems and are more likely at risk of suicide or suicide attempt or substance use problems because of the chronic pain? So some people cope with chemicals. We call them chemical copers. You take a chemical to try and treat your pain. It's a negative coping strategy. Let's talk about opioids. Is there a risk of overdose of opioids in people with chronic pain? And this gets a lot of people heated, the discussion about opioids. Whilst there may have some benefits in opioids, there are certainly risks in opioids. And I've seen this myself over the many years that I've been practicing chronic pain management. People die having chronic pain. And again, is it because of health problems? Is it because of opioid problems? Are there other factors involved? And we just don't know, but we certainly see patients that perish because of this problem. So let's look at opioids and how they may be associated with overdose. Again, a study done quite a long time ago, 2010, but a useful study to pose some questions. This study looked at wanting to estimate the rates of opioid overdose associated with average prescribed opioids and chronic pain. Now remember, this study, I believe, came out of the USA, and the prescribing practices in the USA are different to the prescribing practices in Australia. It had a look at almost 10,000 patients, so 9,940 individuals, and there was 51 out of those 9,000 plus 51 opioid-related overdoses, including 6 deaths. And what they noticed from this study is the higher the dose of opioid that you were taking, the more likely there was a risk, or the higher the risk of an overdose. And they said that if you're taking between 50 and 100 milligrams of morphine a day, you had a 3.7-fold increase opioid overdose risk, 50 to 100. If you were taking 100 milligrams or more of opioids, you were at 8.9-fold increase of overdose. So the higher the dosing, the more likely the risk of overdose was. Now, we don't know if that's accidental or intentional, but the fact is that it appears to be related to the amount of medication. And we certainly know this. The more dangerous medication you take, the more likely you are to have consequences. And it might not be the opioid themselves, it might be the fact that you add in a benzodiazepine, or alcohol is added, or something else is added, and it may be unintentional that leads to an overdose. This study, and again, everything that you might get presented has pros and has cons. This study didn't look at the mechanisms as to why this happened, just the fact that there was an increased risk of overdose. So was it because of excess opioids that were taken? Was it because of a suicide attempt? Was it because of unrelated non-medical problems that led to overdose? Was it because people were not taking opioids as prescribed? Was it because there was another form of chemical use? We just don't know, but we know that the risk is higher. So I hope I've given you a bit of an understanding, a bit of some insights into why chronic pain is so important and how it affects an individual in multiple ways, and it affects the people around them in multiple ways. Not only the people around them, but it affects wider society as well.